There was no testing program initially because he failed to do his job. Now there's no testing program because he's decided it's not his job. And he's decided it's not his job because if it is his job and the American people think it's his job, then they're going to blame him for the loss of life and the economic destruction that comes along with it. And so what you have is this situation where he's looking around for anyone to blame, and that leaves him in a place where he's abdicated his #1 responsibility, and that's his job to protect the American public. I think this news that we're never going to have a national testing program, that the president just isn't willing to do his job because he thinks it hurts him politically, is just one of the lowest moments we've had since this crisis began.
And Dr. Roy, if the American people are under the belief that testing is something Donald Trump was going to deliver, there's reason for them to think that. Here's Donald Trump on testing.
Anybody right now and yesterday, anybody that needs a test gets a test. They're there. They have the test. We've been in discussions with pharmacies and retailers to make drive-through tests available in the critical locations identified by public health professionals. We therefore expect up to 500,000 additional tests will be available early next week. I doubt we'll need anywhere near that. We'll have the ability to do in the millions over a very, very quick period of time.
We inherited a broken test. Yeah. The whole thing was broken.
And remember this, the word is we inherited bad tests. We really inherited bad tests. These are horrible tests. And it was broken. It was all broken. And we fixed it. And we're doing millions of tests. The federal government's supposed to do testing of parking lots in the middle of a certain state that's 2,000 miles away. It's ridiculous.
So, Dr. Roy, it sounds like Donald Trump was for tests until he failed at tests. I mean, where does that leave a frightened public?
Good afternoon, Nicole. It's so good to be with you again on this.
Dr. Fauci, on the question of a vaccine, we don't have a vaccine for SARS. I mean, they got close in mice. We don't have a vaccine for HIV, and life did go on, right? So the idea that we're definitely going to have a vaccine, we didn't really approach much else in the same way as we're pegging going back to normal with a vaccine, did we?
Well, no, but Laura, this is different. HIV/AIDS is entirely different. We don't have a vaccine for HIV/AIDS, but we have spectacularly effective treatment. People who invariably would have died years ago right now are leading essentially normal lives. SARS is a different story. SARS disappeared. We developed a vaccine. We were in the process of going through the various phases. We showed it was safe. We showed it induced a good response, and then SARS disappeared, and we didn't need to develop a vaccine for SARS. So I think it's a little bit misleading maybe to compare what we're going through now with HIV or SARS. They're really different.
But we don't know. This could disappear. I mean, SARS did pretty much disappear. This could as well, correct?
Yeah. You know, anything could, Laura, but I have to tell you, the degree of efficiency of transmissibility of this is really unprecedented in anything that I've seen. It's an extraordinarily efficient virus in transmitting from one person to another. Those kind of viruses don't just disappear.
That's misleading, Laura. I'm going to make that my new ringer. Dr. Anthony Fauci there setting the facts straight last night, beating down misinformation that is often spread on that program by the host herself. For months, she's downplayed the virus. She's cast doubt on the science behind social distancing, and she's attacked advocates of shutdowns and stay-at-home measures. It's a dangerous practice. It's taking place all across that network. Let's bring into our conversation Elise Jordan, a former aide in the George W. Bush White House and State Department, and the Rev Al Sharpton, host of Politics Nation here on MSNBC and president of the National Action None level. Good for Laura for having Tony Fauci on to share facts with her large audience. And on the other, that he even has to say to her, look, it's misleading to compare the disappearance of SARS and the drug treatments available for AIDS to this one. It's just a remarkable commentary on where we are. Let's tell the whole story for any of our viewers that don't take in a lot of conservative media or conservative social media. Dr. Fauci is under attack right now in some corners of the right-wing media. The entire sort of social distancing movement is under attack on Fox News for many, many hours of the day and night as being an overreaction. It seems that there's nowhere more important for Dr. Fauci to appear than right there.
Let's not forget that Dr. Fauci just earlier this week, he did an interview Sunday morning. He did my show, Politics Nation, Sunday night. And they were talking about Fire Fauci, and the President of the United States retweeted that tweet.
Yeah.
And despite that, he went on Fox News. And to his credit, he did not allow them to use him as a prop to try to rally the troops into let's go against those governors that maintain this shelter-in-place policy. We're talking about people dying. I just, for the life of me, cannot understand how you can sit in New York City where all of these studios are, Fox, MSNBC, others, where 600-700 people are dying a day, and you sit up and act as though this will go away. This will disappear, won't it? I mean, how can you even say that when hundreds of people in the city you're in, 30,000 nationally, are dying? I mean, are we acting like these people don't matter? Are we acting like we're not in the middle of a situation where we have 17 seniors found in a nursing home in New Jersey, and you're right across the Hudson River talking about, oh, this will just disappear, won't it? It is absolutely, it's mind-boggling to me.
Well, it's more than mind-boggling. I mean, I think it's a natural evolution of where a leader with no empathy and a leader who has, since his first days in office, only governed for his people. I mean, the feature of the MAGA rallies is us versus them, and I think you see that coming to fruition. I want to ask you, Rev, about something Pharrell Williams said in the last block. I mean, really angry to a point that he didn't even really want to get into it, about not just the disproportionate impact on people of color, but on the inequality that's revealed in our healthcare system and our access to care and the ability to social distance, to do the most protective thing of all. Do you think we're having a robust enough conversation about those issues in this country?
I do not.
Yeah.
One of the things that I wanted to have Fauci on about, which he was which he was very clear about, is that the coronavirus did not start this inequality. It exposed it. It put Klieg lights on it. This has been a problem for many decades where the health care of blacks and people of color has been far less than in other communities, and the fact that you are living under conditions that are different. So how do you tell people that live in housing projects, social distancing, when they have to ride elevators that are smaller than 6 feet, sometimes broken? How do you tell people that live in multi-dwellings that? How do you tell healthcare workers and others that are doing frontline work that have to go to work every day on mass transit, social distance yourself? Social distancing is a luxury for a certain kind of class or certain level of living in this country, and is almost offensive to wipe your poverty or wipe your lower class or your lower income bracket in your face to say, now stay 6 feet away, like it is up to you to do the kind of work you're doing when you're doing it to feed your family. I do not think we're having that kind of conversation. I do not think that we are having an honest conversation. And when we deal with the fact that even with testing, when you don't have the same kind of hospitals and healthcare facilities in communities of color and in black communities on the large part, then how are we addressing the fact that even Fauci saying is a disproportionate impact, but you're not testing there like that, and you certainly not remedying there like that? And then here comes the president saying, let's get ready to go back to work. Let's get ready to come out of shelter, when no one knows how many really in the black community and other communities that have been largely untested, how many of them are in fact infested and can infest others. It is an absolute disgrace.
Good evening from New York. I'm Chris Hayes. The U.S. has had among the worst, most catastrophic responses to the coronavirus among peer nations. And that is in large part because the president has failed at every turn. And the result is unprecedented illness and misery and death in this country. And that doesn't include the economic devastation that has been this president's sole focus from the beginning as he attempts to save his own political future. That means the toll of this virus becomes more and more clear every single day and can't be happy talked away. President Trump now needs to find someone to blame for the crisis that he helped bring about. That's what today has been all about for the president. A day after telling the nation's governors, you're going to call your own shots, he tweeted, the states have to step up their testing. As the Washington Post reports, Trump's "the buck stops with the states" posture is largely designed to shield himself from blame should there be new outbreaks after states reopen or for other problems, according to several current and former senior administration officials involved in the response. Think about that. They're designing it around blame shifting. All along, Trump has wanted to have it both ways. He wants credit for anything that goes well, even for things that don't really ever happen, like the almost non-existent drive-through testing in Walmart and Target parking lots we were promised. Remember that? And he wants to make sure the blame sticks to anyone but himself. As Susan Glasser put in the New Yorker, ultimate power and no responsibility. In a press conference today, New York Governor Andrew Cuomo summed up the president's cowardly "we're here as backup except when we can take credit" mantra.
This is mayhem. We need a coordinated approach between the federal government and the states. All he's doing is walking in front of the parade, but he has nothing to do with the timing of the parade.
Because he can't handle the responsibilities today, Donald Trump tried to steer the blame to Democratic governors, launching a really unhinged series of dangerously provocative tweets calling on people to protect their Second Amendment rights and liberate states shut down by Democratic governors. All this while armed Trump supporters are actively protesting in these state capitals. The reason why he is so desperate to shift the blame is because the blame is coming, because the scale of the national emergency we are going through is impossible to ignore. Here are some headlines from the last 24 hours in American life. The Republican governor of Iowa ordered schools closed for the rest of the year. The Republican governor of Mississippi, who waited for a while to do a shelter-in-place, extended his shelter-in-place order for another week. The Grand Island area in Nebraska now has a COVID-19 case rate comparable to some of the hardest hit states in the country. In fact, CNN reports the bump in coronavirus cases is most pronounced in states without stay-at-home orders. Oklahoma saw a 53% increase in cases over the past week. South Dakota, a whopping 205% spike. The Lompoc Federal Penitentiary in California has the worst outbreak in a prison, 69 inmates and 25 staff members infected. 25 people have died at just one nursing home in Wayne, New Jersey. The people living at the facility have symptoms, and there are thousands of more who have died in nursing homes across the country. The disease is touching every corner of the country. Here's how the owner of a family-run funeral home in Brooklyn, New York, explained the reality there.
The other big issue that we have in New York City, Craig, is there are very few crematories. There's really less than a handful in the whole city of New York. And so right now, for instance, if you wanted to be cremated in Brooklyn, the next available date is mid-May. In 2 cases, people asked for FaceTime so that they could say goodbye to their husband or say goodbye to their mom. So, but it's not how we're made, both as an industry, as a family-run funeral home, but not how we're made as humans. You know, we look for that visual, that human contact, and it's not possible right now. It's not safe.
The president's failure has brought us to this moment. It didn't have to be this way. The U.S. and South Korea both reported their first confirmed cases on the very same day. Around 230 people have died from the disease in South Korea. Over 36,000 have died here in the U.S. It's now everywhere in this country. It is devastating. And there's no more, I'm going to do a song and dance about boosting the stock market, happy talk. That's why you see the president saying today the states have to step up testing. Even that is an acknowledgement of the failure, a concession of how bad things are. And that's what fomenting all the protests is about and trying to restart Tea Party 2.0. The president and his allies are desperate, and they acknowledge it's bad, it's going to be bad. And the political question for them now is, can we blame someone else? Can we blame them? The worst part of this reality is there are some things only the federal government can do. Every state and local official has been saying that. Today was basically a declaration by the federal government of, you are on your own. And not just to the states, this is key. To us, to every American, to every family member worried about a loved one in a long-term care facility or in a prison or driving a bus for a living or working in a meatpacking plant, you are on your own. But nevertheless, it is necessary because there is a loud propaganda arm of the president's supporters who are insistent on pumping people full of misinformation and whataboutism when it comes to this virus.
Now they say 60,000 people will die. 61,000 is what we lost to the flu in 2017 and 2018. The flu.
In 2018, 61,000 Americans died of the annual flu. That same year, more than 67,000 died from drug overdoses. Nearly 50,000 died from suicide.
Hundreds of thousands of Americans die every year from horrific things. Viruses, pneumonia, obviously old age, cancer, diabetes.
You know what kills more people every year than coronavirus? A lot more? Poverty. Poverty kills people in massive numbers. We should remember that.
Look, the fact of the matter is we have people dying. 45,000 people a year die from automobile accidents, 480,000 from cigarettes, 360,000 a year from swimming pools, but we don't shut the country down for that.
Remember any of those people running around after 9/11 saying, actually, you know, the flu kills 60,000 people a year. So, I mean, no, of course not. Coronavirus is not the flu. It's not cigarettes. It's not automobile accidents. It's not swimming pools. They're using these arguments that it is not that dangerous to say that, on balance, we should open the economy back up and just accept those deaths. But what would that look like if they were got their way? If we just said, screw it, we're Americans, we're braving the virus. Well, look at the NYPD. They, of course, had to keep officers out on the streets, couldn't shelter in place. They ended up with 20% of the uniform workforce out sick. Or perhaps the purest example of just maintaining the status quo, a meat processing facility in South Dakota, which kept up production, employees working shoulder to shoulder, day in, day out. It is now the single biggest hotspot of coronavirus cases in the country. Or you can look outside the U.S. in Sweden, where they did not lock down. Schools remain open, and now their death toll is significantly higher than their neighbors. In fact, look at this graph of coronavirus deaths in European countries. That purple line, the one going straight up, yes, that is Sweden. This virus is deadly, and it is really gross and disingenuous and heartless and dangerous to portray it any differently. Look at this chart. All right, these are average weekly fatalities in the U.S. from different causes. This line in blue is what flu season looked like over 2017 to 2018 season. That's a bad fatalities, right? Kills a lot of people. Now in yellow, here is flu plus pneumonia over the same period of time. Again, that kills a lot of folks. Obviously very deadly and dangerous. Now let's add heart disease up at the top there in orange. Much more deadly, okay? One of the top killers in our country. Here is cancer in green. Again, almost as deadly. Now, here's what the coronavirus looks like in red. Yeah. In just a matter of weeks, it has become almost the leading cause of death among Americans. And it is shooting straight up because it is contagious. Swimming pools are not contagious, nor are auto accidents. It's not the flu. It's not smoking. It's not auto accidents. It's not swimming pools. And it's not just here. Look at this data from England and Wales. Follows the exact same pattern. In blue, you see the spectrum of mortality from all causes for each week since 2010. And the red line in 2020, what is that? Well, that obviously is coronavirus. Keep in mind, in the US and UK, these are countries that are basically fully locked down, and that's what it's doing. And in the epicenter, New York City, the place where the virus has spread the most and the fastest, well, it's killed about 1 out of every 700 New Yorkers. On a typical day in April, about 150 New Yorkers die. On the worst day, April 7th, 519 New Yorkers died. More New Yorkers died that week, the week before Easter, than on 9/11. The people on Trump TV don't really seem to care that much about a weekly 9/11 when there's an economy to get running. And whatever certain people want to do with the facts themselves, however sociopathically heartless and cruel they want to be, however much they want to admit that they just don't care that much about this devastating, overwhelming loss, let's be clear about the magnitude of what is actually happening. Part of what is so brutal and confounding about this virus is that there's just